Hello and welcome. Today we're diving into the complexities of rheumatic heart disease, a serious condition that often follows a bout of rheumatic fever. This video will explore its causes, effects, diagnosis, and the steps we can take to prevent it. Let's begin. Rheumatic heart disease is, at its core, a complication of rheumatic fever. Rheumatic fever, in turn, is an inflammatory response to an infection caused by group A Streptococcus bacteria, the same bacteria responsible for strep throat. When strep throat goes untreated or is inadequately treated, the body's immune system can mistakenly attack its own tissues, particularly those of the heart, joints, brain, and skin. This misdirected immune response is the root cause of rheumatic fever and subsequently, rheumatic heart disease. So, how does rheumatic fever damage the heart? The inflammatory process triggered by the immune system primarily affects the heart valves. This inflammation can cause the valve leaflets to become thickened, scared, and stiff. Over time, this damage can lead to two main problems: valve stenosis, where the valve doesn't open properly, restricting blood flow, and valve regurgitation, where the valve doesn't close properly, allowing blood to leak backward. This puts a strain on the heart, forcing it to work harder to pump blood effectively. If left untreated, rheumatic heart disease can lead to heart failure and other serious complications. Rheumatic heart disease disproportionately affects children and adolescents in low- and middle-income countries. This is largely due to factors like overcrowding, poor sanitation, and limited access to healthcare, all of which increase the risk of contracting strep throat and, subsequently, developing rheumatic fever. While rheumatic fever is less common in developed nations due to widespread antibiotic use and improved living conditions, it still poses a risk to vulnerable populations worldwide. The signs and symptoms of rheumatic heart disease can vary depending on the severity of valve damage. Early symptoms may be subtle or even absent. However, as the condition progresses, individuals may experience shortness of breath, especially during exertion, chest pain or discomfort, fatigue and weakness, heart palpitations or an irregular heartbeat, swelling in the ankles or feet, and even fainting. In children who've recently had rheumatic fever, additional signs may include joint pain and swelling, skin rashes, and involuntary jerky movements known as Sydenham's chory. Diagnosing rheumatic heart disease involves a combination of physical examination, patient history, and diagnostic tests. A doctor will listen to the heart for characteristic murmurs, which are abnormal sounds caused by turbulent blood flow through the damaged valves. An electrocardiogram, or ECG, can help detect irregular heart rhythms. An echocardiogram, which uses ultrasound to create images of the heart, is crucial for visualizing the valve damage and assessing the severity of the disease. Blood tests can also be performed to look for evidence of a recent strep infection or inflammation. While we don't classify rheumatic heart disease into distinct types, the severity of valve damage can vary significantly. The affected valve is the main characteristic on which the condition is categorized. Mitral valve is the most commonly affected, followed by aortic valve. Some individuals may have mild valve damage with minimal symptoms, while others may experience severe valve dysfunction requiring intervention. The treatment and management of rheumatic heart disease aim to alleviate symptoms, prevent further valve damage, and reduce the risk of complications. Medications such as diuretics can help reduce fluid buildup, while ACE inhibitors and beta blockers can help lower blood pressure and reduce the workload on the heart. In more severe cases, valve repair or replacement surgery may be necessary. Regular monitoring by a cardiologist is essential to track the progression of the disease and adjust treatment as needed. Additionally, individuals with rheumatic heart disease often require lifelong antibiotic prophylaxis to prevent recurrent strep infections and further episodes of rheumatic fever. Prevention is the most effective strategy for combating rheumatic heart disease. This starts with prompt and adequate treatment of strep throat with antibiotics. Public health initiatives focused on improving sanitation, reducing overcrowding, and increasing access to healthcare are also crucial. Educating communities about the importance of seeking medical attention for sore throats and adhering to antibiotic regimens can significantly reduce the incidence of rheumatic fever and, consequently, rheumatic heart disease. The prognosis for individuals with rheumatic heart disease depends on the severity of valve damage, the presence of other medical conditions, and adherence to treatment. With proper management, many individuals can live relatively normal lives. However, rheumatic heart disease can lead to serious complications, including heart failure, stroke, and infective endocarditis. Recent research efforts are focused on developing more effective strategies for preventing rheumatic fever and treating rheumatic heart disease, including the development of a vaccine against group A Streptococcus. These advancements offer hope for a future with fewer cases of this devastating disease.